Alzheimer's Disease Research Center in Albany. Thank you for coming. I'm Lois, by the way.
Thank you guys so much for having me. It's been incredible. I appreciate you giving me the chance to come and see you all, meet you, and
Close it.
uh, uh, just tell you a bit about who we are and what we do. So my name is Dr. Robert Holub,
I've
and
probably seen you on TV.
oh, good. That means it's working. I like that. It's always nice to hear.
You're too young to be involved in all this research stuff.
I've actually been doing it for like 15 years, so a long time now. But the center was originally started by my father, who's still the principal investigator and president and CEO of the company. He started this before I was born. I'm 42, and he's been doing this since before then, in the same building on Madison Avenue in Albany. He's a neurologist by trade and had a clinical research office where he basically from the 80s on through now are doing human clinical trials trying to find treatments and cures for Alzheimer's disease. Alzheimer's disease is, we're all familiar, everyone is touched by it in some way, shape, or form, but it's basically a disease where we get robbed of our memories, where the memory center of our brains gets destroyed over time, and it leads to a loss of functioning and more dependence on others for care. It's one form of dementia. Dementia is this kind of umbrella term for anything that affects our thinking and memory. And all those dementias out there, Alzheimer's is, oh, I'm good, thank you. Alzheimer's is sort of like the lion's share of it. So most dementias are actually Alzheimer's statistically. There is a bucket of other stuff that causes dementia, like vascular, Lewy body, Parkinsonian dementias, frontal temporal. You'll hear about those from time to time. Certain celebrities might get it, and then it's in the news. But far and above, Alzheimer's is the most common thing, and that's really what my father and now myself have dedicated our lives to working on. We deal with it personally as well as professionally. It's something that runs in our family, and I know I have one of the genes that increases my risk for it. And it's something that my mother suffered from, so it's really near and dear to our hearts. I think that's part of his motivation for having done it his entire career, and now I'm doing it for most of my career as well. Um, and I guess the messages I'd like to kind of convey to you guys is that who we are and what we're doing. So we are present in the local community, have been for a long time, and what we're looking for are for if you know of anyone who has concerns about their memory or maybe is already diagnosed with Alzheimer's disease. We are actively recruiting for at least 14 trials right now, where we're trying to find patients who are willing to be part of a trial to try and test new treatments. And for the longest time, the core group were people who already had pretty advanced memory symptoms. We used to only be able to diagnose Alzheimer's once people's memories got pretty bad, where it was like more obvious that they were having a memory problem. That all has changed and changed really quickly and dramatically. We now have blood tests and brain scans that can tell us 10 to 20 years before someone loses any memory at all if they have Alzheimer's disease. It's been a really big game changer. This blood test, you may hear more about it. It's called the p-tau 217, and it's a test now that your primary care can do. And it's being used as the initial first-line test if someone comes in with a memory complaint to say Alzheimer's yes or Alzheimer's no. Now that test turns positive really early, and so it's letting us catch it earlier and earlier. And all the treatments that we're working on now tend to work better the earlier in the disease that we catch it. Does that all kind of make sense so far? This is very informal. I don't. Yeah,
Very
please.
informal.
Questions? Yeah. Yeah. Absolutely.
So my mother had Alzheimer's.
Yeah.
And her two sisters, we believe. History is a little sketchy sometimes, but my mother definitely did. And so there's genetic testing, and then there's this blood test. Has treatment changed? Well, maybe you're going to get to that.
Yeah. No, that's a great segue. So, to date, every drug that we've had for Alzheimer's, we were a part of in our clinic. So everything that's been approved by the FDA over the past 40 years for Alzheimer's, we were a part of. We did the trials for them. The older drugs that we've used for 30 years, I'll just say the names. Some of you may have heard of them: Aricept, Donepezil, Namenda, Memantine. We've known since they came out 30 plus years ago that those don't change the course of the disease. They're really band-aids that if you're lucky, they help your brain a little bit to use what you got, but they're not fixing or changing anything down the road. It is a progressive disease and it gets worse over time. By the time people first come to see us, when they're having memory trouble, the average progression is somewhere in the neighborhood of 2 to 7 years from being independent to no longer independent. It's a bell curve. Some people it's a year, some people it's 10 years, but the average is about 2 to 7 years. And so even just knowing that is crucially important for people. And it was only 2 years ago that we developed our first treatments that got approved that do actually change the course of the disease. They're called disease modifying treatments. There's a catch though. These drugs are advertised like heck on TV right now. You may have heard of them. They're called Kisunla, donanemab, or lecanemab, Leqembi. These drugs can slow the disease. You have to get an infusion once a month, and you do it typically over a year and a half or indefinitely for one of the drugs, but they only slow the disease a little bit. They slow it by about 2 to 11 months. So it wasn't the answer. Exactly. Well, what good is that? That is an important question. So I think that the biggest thing is that we've touched the disease. We never had anything that actually slowed it, but this can slow it a little bit. And for some people, that's worth it for them to have that extra time with their family, to not be a burden, to be independent and still living their life and doing the things they want to do.
Is it worth it with side effects? So there's something.
Yeah, exactly. That's the other big caveat. So for these particular treatments, there was a very high risk of brain swelling and brain bleeding. And it's actually worse if people have the worst genetics. And that's why we test for it and look at that, because if they're higher risk from those side effects. And if you're on blood thinners like Coumadin, warfarin, Eliquis, Xarelto, for which a lot of people are for AFib and other things, you can't have those drugs at all. So for a big segment of the population, they're not even an option right now. These drugs got rid of the main protein involved in Alzheimer's called amyloid. And our hope was by getting rid of it and cleaning it out of the brain, we'd stop the disease. We were all hopeful for that. But that's not what happened. We actually do remove all of it, but the disease still progresses. So there are other proteins and inflammatory processes we're targeting now, something called tau and then inflammation in general, that we're actually very hopeful may have that much better effect at slowing the disease. And that's where most of our trials are centered now. Please.
Well, first of all, the medications that have existed so far have been really, really expensive. And I wondered if now, if you have this drug test, if insurance companies will be more active in helping to support the therapies.
Yeah, so that's the hope over time. So right now, the two drugs I mentioned, the Kisunla and Leqembi, those are approved by the FDA. They are partially covered by Medicare, is what I'm told. Without insurance, they're $36,000 a year or something crazy, and one of them you take indefinitely. Those costs are going to come down in time, but those are all set and come from forces far greater than myself. And I wish we had more control over those things. But I think it's important to know that these things exist now. A lot of people would tell me when I said, oh, I can find out if you have Alzheimer's, when you're 50 and feel fine. And people say, well, why would I want to know that? And the fact, and I get that, and for the longest time that was our thinking. But the fact is now that we can alter the course of this disease, and we're working on stuff in research now that we're hoping is much safer. We already know that it is, and much more effective. That's really our goal with the research. Please.
I just wonder if you could take a second just to review what's actually happening that causes Alzheimer's.
Yeah.
So if you take out the amylase, so what is happening?
Yeah, so we actually don't fully know yet what causes Alzheimer's. We know a lot about the process and a lot about the things involved, but the actual spark and what leads to it is still a bit of a mystery. In general, it seems to be that over the course of our lives, we have this buildup of these toxic proteins. They're normal proteins in our brain. They have a normal function, but they build up over many years and decades. If we have the worst genetics, those genes are usually tied to other things that help clean out those proteins. And if we don't have a good cleaning system, those build up even earlier, and we're getting Alzheimer's in our 50s and 60s. Other people, it's actually protective, and they may never get Alzheimer's. For most of us, if we live to be 150, we'd probably all get Alzheimer's eventually because these proteins would be building up. Amyloid is one of these protein byproducts. And then amyloid, when you get enough of it, sets off this other protein called tau. And all of those, as they start to build up, actually lead to neuronal cell death and memory cell death that causes memory loss. And when you look on MRIs, people's brains actually shrink a little bit from the loss of those cells.
That's very true.
Yeah, please.
You mentioned the word inflammation, and that makes me think of autoimmune. Is it possible that this could be part of that?
So there may be some people's autoimmune diseases that contribute to this. There's an important thing called the blood-brain barrier that blocks and protects the brain. It's considered a immune protected site, but that's not universal. And there are certain things that cross that barrier, cause chronic inflammation in our lives, basically our immune system being chronically stimulated. And over many years, that's one path to which Alzheimer's gets driven. Now, that may not be the only cause, but it can certainly be stepping on the gas pedal of the Alzheimer's disease. A good example of this you might have heard about is shingles. So chickenpox was a virus. I was the last generation to get this as a kid in the 80s, hopefully going forward. But basically anyone who had chickenpox as a kid, you can get shingles as an adult at any point, younger adult, later adult. And it tends to come out as we age because our immune systems get a little bit weaker. Our whole lives, the virus stays in us, and our immune systems keep it at bay. But as we age, it gets a little weaker. Usually, end up in the hospital with a broken leg or something, or a pneumonia, and then boom, you get a shingles outbreak because your immune system gets distracted. But we know that even if when you're not having the really painful, horrible rash of shingles, that virus is still active in your body microscopically, and it's actually causing inflammation in the brain that we're very convinced now is one of the driving forces behind memory loss and Alzheimer's. And we've seen that people who get their shingles vaccines, which are really good now, it's a series of 2 shots, got to make sure you get them both, but that seems to be directly protective against Alzheimer's disease. And that's why I'm a big advocate of shingles vaccines in particular. We had a study going on now as well that's looking at people who have a certain bacteria in their mouth called P. gingivalis that contributes to gum disease. Turns out this bacteria also secretes a toxin that goes to your brain and further drives chronic inflammation. So we have a study looking at blocking that toxin in those people. So the inflammation is one of the factors, and I think if you didn't have an inflammatory sort of kick, you may not develop the full Alzheimer's syndrome as we know it. And I think that you need those bad proteins and then some sort of inflammatory kick. And it may be down the road that, like with cancers, there's 20 different types or 100 different types of lung cancer. You get down very specific to the kind. There are probably going to be these different subsets of Alzheimer's, which have different things that set them off. We just don't know enough yet to categorize all of them, or let alone have a specific treatment for each one. So we're a little behind as far as compared to cancer research in the Alzheimer's world. Please. Yeah.
Is AI helping you guys at all?
Yeah, so we are actually, AI is being used in research in several different capacities. Yeah, good to see you too. Oh, great. So AI is being used in an informatics way, looking at what's called proteome expressions, trying to find these categorizations of different types of disease states in different parts of the brain. And it's basically doing it at a scale that individual people haven't been able to do. So it is being actively used by people far smarter than myself. So yeah. One of the exciting things is not only do we have programs going on for people who have disease, who already have memory loss, we do have a program now for people starting at age 50 who have no memory symptoms whatsoever. And we're testing them to see if they have Alzheimer's going on in the background. If they do, they can then enroll in a trial where initially they're either put on a placebo or on the drug, and we don't know, we're all blinded, but that's how research works. And it's a drug trying to actually prevent them from developing Alzheimer's in the first place. And so we're talking to the children of people who we see in clinic who are affected by Alzheimer's if they're interested. As part of that, we do genetic testing and we test for the Alzheimer's. But then most importantly, we have something to offer them because right now there is no approved treatment to prevent Alzheimer's disease at this time until we show the research that it's effective and safe, which is what we're working on.
Is it different? Is Alzheimer's different if you get it at 50 than it is if you get it at 80?
Yeah, so there can be different variations and different speeds and presentations. The same core underlying molecular changes are the same when you really look at them, which is why we can use the same tests to study them. but it's the same process. They just happen in maybe slightly different ways or slightly different areas of the brain, or the initial spark that sets it off may be a little bit different depending on the age and the genetics. But the downstream final common pathway, we call it, is this Alzheimer's syndrome that we see. And so my main hope is to let people know that we're here doing this, and we're bringing access to these global trials to really, we have a very large trial. We have patients who come from Maine to do our trials, so driving 5 hours once a month to come and see us to get their treatments and to get checked on it. So it's a very humbling thing just to see how much need there is. And if any of you have tried to go to your doctor to get referred to a specialist, such as a neurologist, right now at Albany Med or St. Peter's, which are our main academic centers around here, you're looking at least 8 to 12 months, if not more, for a first appointment. And with Alzheimer's and memory concerns, that is unacceptable. That's, time is brain, what it boils down to. And the longer you go, you're not being diagnosed and treated, the worse off people are going to be. Because of these tests, we can now catch this very quickly and early. And so we can get people in on our office within a couple of weeks to help clarify the diagnosis, to offer them an option in research, or to give them our best advice on outside treatments in the real world. And I will do that for each and every patient who comes through our door. And the biggest thing is that we get to do all this for free. So we are not charging patients anything. You don't have to pay to do research. There's no insurance involved. We never take their card or anything like that. People who do research are doing the world a service, and so they don't get charged for that. They actually give people money for gas because they want to lower the barriers to participation. We want to get good data at the end of the day. And that's why it costs about $1 billion to develop a new drug. That number might have gone up recently. Yeah. Yeah.
Is it true that when you're sleeping is when your brain clears out all that extra debris? So sleep is the integral part of remaining healthy?
Absolutely. I'm impressed you know that. So yes, sleep is critically important. During REM sleep, there's something called the glymphatic with a G system that cleans out a lot of the normal stuff that builds up from using our brains all day. About 20% of your body's calories go towards just your brain every day. So it's really burning and churning throughout, and all this stuff builds up that needs to be cleared out. And that is one of the factors that we see sleep is providing for. We also know that people who have sleep apnea that they don't treat, that's where you stop breathing at night, and actually it's like getting choked all night. Those people actually develop dementia in general and Alzheimer's specifically faster and more aggressively than people who don't have sleep apnea or are treating it. So it's one of those things we have clear evidence that even though people might hate their machines, they got to find a way to use them. There's a few other things like that we know are protected that have good evidence. So if people need hearing aids, making sure that they use them. When we can't hear, we withdraw from conversation, we stop being social, and it speeds up all forms of dementia. And that goes along with socialization. Doing clubs like this is incredible. We want people being out there and being engaged with people. A lot of times, as we have hearing or memory troubles, we become more hermitish and we don't leave our houses, and that we know that speeds everything up. There's a few other things that we know are helpful are getting a lot of good exercise, about 2.5 hours a week. And that's where you're getting your heart rate up to the point where you can talk, but you can't sing. That's sort of my marker of how hard you're working. And it's funny, you can do that all in like one weekend warrior 2.5 hour session, or that you can actually do it in 5-minute increments throughout the week. They studied this, and it's exactly the same. Doesn't matter how you do it, but on average, 2.5 hours a week of that kind of level of exertion. That can be yard work, house chores, stuff like that. And then brain games and brain training are very important. So if you like puzzles, Sudoku, New York Times crossword, we just found the more you use your brain, the more likely you are to keep using it. So those are things with good evidence. There are no supplements. There's nothing from jellyfish. There's a whole supplement industry out there. The issue is supplements are regulated as food by the FDA. So they can say anything just like if they're selling a box of cereal.
So Prevagen is a nothing?
Prevagen is a nothing. You're going to quote me on that.
I went to a talk from your father, and he said, I'm going to say it 3 times. Prevagen doesn't work. Prevagen doesn't work. Prevagen doesn't work.
And it's worse than that. It can hurt people's kidneys and actually damage people. So it's one of those things. And I promise, if there was a supplement out there that really worked, that was good, you'd hear about it. It wouldn't be a secret. It wouldn't be advertised on TV by one big. It'd be a well-known kind of thing other people would be telling you, I promise. So,
Any
so yeah.
research about food to avoid or substances to avoid, like aspartame, saccharin, that kind of stuff?
Yeah, so that is being researched that's more at like the academic university bench research level. I know people are looking at those artificial sweeteners and things like that. They're implicated in many other disease processes, but so far there's not a clear link with Alzheimer's. Similar to things like marijuana, it doesn't help your memory, but there's not necessarily a direct link to Alzheimer's disease. We know that Mediterranean diet a modified Mediterranean diet tends to be the safest from a blood flow perspective. And a lot of things that help with dementia and memory are supporting blood flow to the brain. So controlling blood pressure, diabetes, cholesterol, all of those things are important to control over time and lower our risk of having memory problems because we support good blood flow to the brain to clear all that stuff out. But yeah, please.
Is Alzheimer's associated with affecting hormones, cause people to be depressed or unhappy? Is there any correlation there?
Yeah, it's interesting. So as Alzheimer's progresses, depression and anxiety really do become part of the disease course. There's a lot of reasons why this is. Part of it is when our brains aren't working right, there's a time where we realize it, and that's depressing. But there's also other biochemical things going on in the background. Most of our patients eventually who have Alzheimer's end up being treated for anxiety and depression with some sort of SSRI like Lexapro, sertraline, Prozac. They work well and can help mitigate those symptoms, but it is almost part and parcel with the disease, especially as things progress. So we do see those commonly. The causality isn't the best understood, but it's something we're well aware of and is usually a co-condition that we manage, even if it didn't exist before. But yeah, good question. Please.
Kathy asked between these three sugars, which one is the best one to use?
If I can see which ones you're holding up, I strongly recommend regular
sugar and Splendid.
Yeah,
and
regular cane sugar, maybe even raw sugar versus the white processed stuff.
Yeah.
But at the end of the day, cane sugar, all things in moderation are the trick. And the real uh, evil in food that I espouse against, or advise against rather, is high fructose corn syrup, which is legal in the United States. It's not legal in Europe, but it's in everything. So if you look at this ketchup bottle and you look through, yep, my favorite barbecue sauce, Sweet Baby Ray's, it's all high fructose corn syrup. At least Heinz, to their credit, they have a product called Simply Heinz that you have to look a little deeper in the shelf to find. They don't have it at Costco. But if you look a little deeper, they have a version that's cane sugar based. And that actually is much better and safer for you. High fructose corn syrup is sweetened with fructose. Now, fructose is a special sugar that is only consumed by your liver. And so every calorie of fructose goes straight to your liver, causing something called non-alcoholic fatty liver disease, which then can lead to liver cancer or liver failure, as well as diabetes and other problems. Glucose or table sugar, sucrose, can be eaten by every cell in your body, and it's the only fuel that your brain uses. So regular table sugar, solid sugar, is actually healthier compared to most of the stuff that you're going to find that's put into ketchup. All the jams and jellies they use at diners, you have to really read those labels carefully. It's really hard to avoid, but it can because there's more and more awareness of this. And we know that if we avoid things like that, avoid the really high fatty meats and those things, we're ultimately helping the blood flow to the brain, which helps with Alzheimer's disease. So, yeah. Yeah. So Simply Heinz, and I've given a whole talk on this in the past, but it's a little off topic. But just to say, the reason why high fructose corn syrup is everywhere is it's extremely sweet tasting, and it's liquid at room temperature. So back in the early '80s, for manufacturing reasons, they used it suddenly to switch from physical raw sugar in sodas and sugary drinks to just using high fructose corn syrup. So you'll hear about like cane sugar sodas or Mexican sodas, and those are where they still use regular sugar as opposed to the high fructose corn syrup. And then it found its way into all these other products as well. So That's getting off my soapbox on that one, but it's important to pay attention. So, but yeah,
Caffeine.
yeah. So caffeine's actually interesting. So there actually are some benefits to caffeine in the medical world. Not necessarily detrimental from the memory and Alzheimer's perspective. So caffeine, I'm okay with, again, in moderation if your blood pressure and heart and everything else can handle it. So. But yeah, does it kind of make sense the way I've laid it out, as far as who we are and what we do? And I guess I would just say again, if you have anyone who is already worried about their memory or already diagnosed with Alzheimer's, or the children of those people who are just worried and want to get checked out, please have them come and see us. Let them know we exist. We can get them in for free. See if they've got Alzheimer's going on, and then more than that, if they do and they want to do research, we can pair them with a research program if they choose to do that. But they don't have to. We could just evaluate them, even if research isn't for them. I found that by having anyone who wants to come in get evaluated, they might, even if they're not a research candidate or they don't want to do research on their own, they will then tell 10 other people about what we did for them, and that pays it forward. And we've really noticed that.
So memory loss is not the same as forgetting. I mean, we all forget. I can't remember names to save my life.
Yeah.
So,
So
when you get to a certain age, it's like, oh my, I can't remember.
yeah, so we used to say, oh, that we call it the tip of the tongue phenomenon. You go for a word or a name and it's just not there. And we used to say, oh, that's normal aging. Don't worry about it. And sometimes that's true, it turns out. And what does happen with normal aging is the processor of our brain slows down, but the information is still intact. And so the name might come to you 10 minutes that night, the next day, and eventually it pops back in there. It just takes longer to retrieve that information. There's a spectrum of that is normal. But with these new tests, we found some people that's actually their earliest symptoms of their Alzheimer's disease. So it's not as clear cut as it used to be. And even people with that, I would consider getting this p-tau 217 testing done.
That's a blood test.
Yeah, and actually, while we're talking about it, I have some of these. I have a little trifold about our clinic, and this is actually a card all about the p-tau test. So I was just gonna kind of pass these around the room, and I've got plenty more, and I'll do these later. But yeah, it's just basic information. Please.
I was like,
That leads to memory loss,
I'm
like
sorry.
a head injury.
Yeah, so that's another thing that can affect your memory, and actually lead to dementia. Is we're asking about head injuries. So we know football players, people who get mini concussions, they get something called chronic traumatic encephalopathy. It causes memory loss for a different reason. It's the same kind of thing where those memory cells are getting destroyed, but it's for a different reason. And it's certainly, thank you very much. Yeah, we can pass these out to you. I would say we're also passing around my business card. I was very proud of my business card because I recently got a QR code on the back for our website and for the LinkedIn. I was really proud of myself for that. So yeah, but yeah, so head injuries, they make everything worse and they complicate the picture. A lot of people's Alzheimer's exist with maybe a history of some concussions, maybe a history of some bad blood flow problems. So it's not totally in a vacuum of pure Alzheimer's a lot of the time. There are overlapping diseases that can happen. So great question. Please.
So, I'm sorry, did you have questions for? I don't want to step over. You talked about exercise and puzzles and all that.
Yeah.
So you're like exercising your brain.
Yeah.
That's fascinating. Like, can't we bottle that? I mean, if that's something that Livingston can delay or
Yeah, we know there's
take advantage
good
of.
evidence that it is neuroprotective and can delay and either prevent dementia or slow it down when it's getting going. And it's just reaffirming those interneuronal connections in the brain. The more you use those pathways, the more that they're able to avoid something called synaptic pruning, which is where you lose those connections over time. And again, why those MRI pictures of our brain start to shrink down over time. So there's a lot of different ways of doing that. But I say whatever one is your favorite, where you're using your brain, that's really the one I want you to be doing that you're going to do regularly.
You get into behavioral issues like occupational therapy type approach to how working with Alzheimer's patients.
Yeah, I would say down the road with more advanced disease that we involve those kind of services. It's obviously a very challenging patient population to work with, but we do our best as a health system. I use that word a little bit loosely here, But it's just very patient dependent at the end of the day. So, but those things are certainly considered. Yeah.
Bob, thank
Please.
you.
Yeah, absolutely.
Okay.
Oh,
Can you, if anybody has any questions, can you stick around for a couple
yeah,
minutes?
absolutely.
I have
Yeah,
a
Awesome.
sure. Yeah, I'll hang out. Yeah.
Yeah, we need to close the meeting.
Okay.
And we always close the door to restore a test. And we try to keep in mind as we go through our week that everything we think, say, and do. Is it fair, all concerned?
Will build goodwill and better friendships. Will be beneficial to all concerned.
Well, it'll be fun.
Do you find anything with
Thank you
for
very much.
ADHD or autism? Do you find any increase or not necessarily?
Yeah,
Or?
not necessarily. There can be overlap in the symptoms sometimes, and that's something that occasionally comes up is someone's having attention concerns, is it memory? And it turns out they had undiagnosed ADHD that they sort of compensated for their whole life. And maybe they don't have Alzheimer's, but it was their ADHD that was sort of getting in their way and they didn't realize it. So that does come up, and that's part of the neuropsychiatric testing we do to figure out, because there are things that mimic Alzheimer's. Is this ADHD? Is this just severe depression? Is this a medication side effect or issue? So we want to rule out those things before we say, confirm if someone has Alzheimer's disease.
Not necessarily a propensity to get Alzheimer's.
Right, exactly. Yep, that's exactly how I would say it. And again, they can coexist, which is the other thing, because Alzheimer's is just so common on its own. But yeah, please.
Wondering, this is kind of a side thing, but as a nurse, been years, why are we seeing a decrease in service lines like neurology, rheumatology, physical rehab medicine? Why? I understand there's money in it because the procedure guys learn more.
Yeah.
So I guess you have to have, I'm answering my own question, I guess. You have to have a patient for the specialty. If you really want to make less money, I guess. But there's such a need for neurology, neurosurgery, rheumatology is such a huge need for it, and yet we're running out of people.
And I would add in primary care. I'm a family medicine doctor by training and practiced for over a decade out in the Berkshires in primary care. And what I would say is that if you look around, what we have plenty of, a dime a dozen would be orthopedists and dermatologists. And that's because those are higher paying medical specialties. And of my UCLA medical school graduating class, we had, probably half of the students going into some field like dermatology, radiology, or orthopedics. And I was one of maybe two who actually went into primary care, let alone neurology or other subspecialties like that. So a lot of it has to do with economics, is my best guess, and the way that our educational system is structured, and the reward structure, because a lot of doctors, again, off the beaten path, but you asked, a lot of doctors get a lot of debt going through medical school, hundreds of thousands of dollars when they're 22 years old, and that's a big factor on what they can do afterwards and getting that debt repaid. And I think that's probably at the heart of why people choose certain specialties over others during your training when that time comes. Yeah. Well, thank you all for listening. And again, yeah,
great.
Oh yeah, please. Yeah. So Prozac is an antidepressant, anti-anxiety medicine. So it's very commonly used. It's a very good medicine. And there's probably 10 different versions of it with different names that all work on serotonin in the brain. And they're daily medicines that we take that basically can bring down our anxiety levels. And if we're feeling depressed and not wanting to get out of bed, oh, you're most welcome. Thank you. Yeah, oh, that's great. It can give you some motivation, some energy, some gumption back to get out of bed, and it helps restore that serotonin balance in your brain that can pull people out of that sort of funk of depression. And depression and anxiety is sort of like where we're on edge, we can't relax, we're hypervigilant. They're different symptoms of the same problem with serotonin in the brain. So most people get a mix of the two. They can be depressed and have some anxiety. Some it's more anxiety, some it's more depression, but we use these same medicines to treat them. And Alzheimer's can bring these things out in people as it progresses as well. But anxiety and depression are probably one of the biggest reasons people go to the doctor in the first place, because it's common, right? We have these lizard brains that used to keep us alive when there were tigers everywhere, right? It was helpful to be like, I can't sleep because there's bears everywhere. that kept us alive. But now it's maladaptive, where there's not as many bears and tigers, but we still get on edge for no reason. And so that's a lot of people find that it's a very common issue.
One more.
Yeah.
Trazodone.
Which one is
Trazodone.
trazodone? Yeah.
Because of your headache.
So trazodone, I'm not wild about. Trazodone is used basically as a sedative sleep aid. It's kind of, yeah, it doesn't really fix anything. It's basically a Band-Aid, and it kind of just hits you over the head and helps you sleep better. And yeah, and so it helps you sleep, but the problem is anything you take regularly to go to sleep, whether it's trazodone, Ambien, or even melatonin, if you take it more than a couple nights in a row, you actually become dependent on it. Your body expects it, and then if you don't have it, your brain says, "Oh, I can't sleep. I haven't had my trazodone." So it really creates a new sleep problem that wasn't there in the first place. So it's a delicate act. So trazodone is a little bit trickier, but the main thing with it is it's not actually fixing anything. Unlike Prozac or sertraline or those medicines, those really do fix the problem. That medicine is just sort of a Band-Aid, kind of hits you over the head. It helps when you need it, but yeah, I try to use those things sparingly.
Yeah. So people don't call you like you think you taking that.
No, oh no, definitely not. And as far as like Prozac goes, something like 20 to 25% of people are on medicines like that. So yeah, that there was like a lot of stigma a long time ago, but it's not anymore. Yeah, it's really common.
So he gave me when I have it.
Yeah. Yeah.
There's a lady. Is the only thing push down birthday? I know you're not.
Yeah. I gotcha.
The neurologist, it's very hard. There's no doctor.
Yeah. I know. Yeah.
My problem is for bakes.
Yeah.
So they said, well,
Yeah, and it just depends on like how far you're willing to go. Exactly.
Where to go?
Yeah, so on here, there's Albany Med and St. Peter's. There are a few private neurologists, but most of them are filled up. There is up in Saratoga Hospital, they have neurology, and Ellis Hospital has neurology as well. Generally, what I'd recommend is you just call each of them and see if you can get an appointment. Now, they might say it's not for 6 months, but at least just keep it, and then eventually it'll get here and then you'll have it. Yeah, Ellis has neurology as well, I believe. Yeah. Yeah. And what I've also heard is that most of them have gotten rid of their waiting lists because I used to always tell patients that, or a cancellation list, right? And they claim they don't have them anymore. So, yeah. Well, yeah. Thank you guys again for having me. I appreciate it. Any chance I get to just tell people about Alzheimer's and the changes, because so much has changed so quickly. A lot of doctors don't even know how good the tests are and what treatment options are now. So it's a great opportunity.
I see your ads on TV all the time, and I've heard your father speak of Brendan all day first.
Yeah.
And it's love when you've had dementia, so it's very interesting, and we appreciate you getting in touch.
Yeah, absolutely. I think one of the reasons I do this is that we've gotten so good at preventing heart attacks and strokes. Statins